Good morning, I'm Amy Lynn. Now this next topic may be a little bit embarrassing to talk about, but many people suffer from fecal incontinence. But there are new procedures for treatment that can help. And here to tell us more about this is Dr. Fia E. Good morning.
Good morning.
I imagine this is not something that people like to have conversations about because it is embarrassing.
Right.
But I'm a firm believer in communication being the biggest problem solver that there is. So you shouldn't be embarrassed. We're all human. So let's talk about it. How prevalent is fecal incontinence in our population?
So as we get older, things don't work and things fall down. And most women would understand that analogy.
Right.
And so unfortunately, because it's a taboo topic still for a lot of patients, we don't have exact numbers of how prevalent it is. But I will say that more often than not, patients will come see us in the clinic for something and then off to the side would use that as a segue to actually talk about their incontinence.
Right. It's one of those things that's so important to bring up.
Absolutely.
That would just bring it up because there are treatments. So what can be done to help?
So most people have had or experienced a sphincteroplasty, which is an actual surgical procedure where we cut the sphincters and try to recreate the muscle mechanism of the sphincter. It's a pretty extended operation in terms of recovery, and for most women, it can be pretty painful to recover from as well. As you know, it's a very sensitive area.
Right.
So now we have the benefit of having a very minimally invasive technique using a sacral nerve stimulator. So most patients probably are more familiar with like a defibrillator or a pain stimulator. And it's very similar where you have a battery pack that's implanted into your body that basically generates an electrode to stimulate a nerve to help with the continence mechanism of the pelvis.
Oh, that's so interesting. And I'm sure that you know, the ladies are thinking, oh, thank goodness, because nobody likes to hear extensive recovery and pain, right?
Exactly.
So how do you suggest that patients go about bringing up the subject? Because it's important to let you know you can't treat something if you don't know about it.
Absolutely. And just as you touched upon, it's just important to just bring it up. Your provider wants to help you, and there are resources out there. So if you just bring it up with your primary care physician or your OBGYN, they can direct you to folks like myself who treat this problem, and we can talk about the options that are appropriate for you.
Well, Dr. E, I appreciate you coming on and talking about it because, again, conversation and communication is key.
Absolutely.
If you want to find out more, just log on to our website, which is fox4morningblend.com.